Well, welcome back. Joining us in studio right now, we have Meredith Warner, and I'm so excited that you are here because we're talking about kind of like your approach to wellness. And you have a book out called Bone on Bone, and it kind of gives people a tangible way to take control of their health. And we were talking during the break that wear and tear on the body as we age, we can control that.
That's right. So this book kind of came about after years of me following patients in clinic and noticing that everything I was taught in medical school and in residency did not seem to be making a dent in terms of population health.
Yeah.
And even in individual people, you might fix a body part here or body part there, but inevitably there was more pain, something else happened, more aches and pains. And then I started to realize maybe we're not doing things correctly. And also I came of age during the opioid epidemic. So when I was a resident, it was just getting full throttle. And that's when you really realize maybe there's something wrong with medicine. You know, so after years of research and learning more about diet and nutrition and things like sleep, mindset, exercise, I decided to distill it all into this book. This has been kind of a passion project, like 2 years of work, really just to let me tell patients at a bigger level to have more impact, because you see 30 patients in clinic a day. You can't explain the Mediterranean diet, the importance of the circadian rhythm, sleep, mindset, like it's just impossible. And so that's why I wrote this book.
And so we were talking, there's a couple of pillars. Can you kind of touched on them a little bit in your introduction. What are they for our friends at home so they can kind of be more mindful?
Yeah, so we kind of distilled it down to an acronym, MEDS, or MEDS, which is mindset, exercise, diet, sleep. And there's no particular order, although I think you first have to kind of really believe you can do this, which is mindset, of course. So mindset, exercise, diet, sleep, and then it just goes into each one and how you can improve it and gives you the scientific mechanisms and rationale behind it. For instance, the actual mechanisms where your brain connects to the peripheral end organs or nerves that tells you how mindset really can control how you feel. It really can help pain diminish. And then nutrition, how that plays into your overall flexibility, your overall levels of inflammatory markers, which also in turn affect pain. And then how things like exercise and retaining muscle, particularly for women as we get older, how important that is, not just for how you feel, but your cognition. So it's all linked and everything is synergistic. But what I did was made a protocol where you could just take one little piece that would work in your life and then add another one as you mastered that one, and then add another one, and you could just kind of snowball it into feeling great. So like I feel better now than I did when I was a resident, physically and mentally, because I eat better, I sleep better, I have a better mindset about everything. And I kind of just have empowered myself to feel better as I get older, and I just want to give that to other people.
Well, I'm so glad that you're here to share this. And if people at home want to take a look for themselves in this book, where can they find it?
Well, the book is everywhere. So in Lafayette, I'm doing a signing at Barnes & Noble on July 20th, for example, but it's on Amazon. And I actually found out about this site called bookshop.org, which if you want to support your local bookstore, you go to bookshop.org and you just put in the name of your local bookstore, and then the profits go to them.
Nice.
So that's another good thing you can do for your community.
I appreciate you stopping by to take the time to share your knowledge with us today. If you at home want to get your hands on this book and read for yourself, kdn.com. Let's check in with Michael Crowley.